Australians put a high value on mental health, but most of us aren't engaged with issues surrounding mental health care. Research out today has grouped Australians into 5 categories, showing the varying attitudes towards mental health, how they think the system is functioning and whether it matters to them. Angus Randall reports.
Stuart Baker hadn't given much thought to his mental health until his teenage daughter Mary had her own battle.
I think for the first time we experienced poor mental health in our family, and we hadn't encountered it before, and it was a real struggle because Mary had an eating disorder.
Mary was 15 years old when she died by suicide in 2011. Stuart Baker says there was a lot of sympathy but not much understanding.
Eating disorders weren't even considered to be a mental health problem by a lot of the community at that point. So it was a real struggle, and unfortunately we weren't able to save her.
A new report by Australians for Mental Health has taken a look at attitudes toward mental health and grouped people into 5 categories based on their views, ranging from those educated and engaged about mental health support to those who don't really think about it, all the way to the 15% who believe descriptions of a mental health crisis have been exaggerated. Dr Rebecca Huntley is the Director of Research at 89 Degrees East, which carried out the survey.
Did they feel that we were in a mental health crisis, and who did they think was responsible? Did they think it was mental health was something that, individuals were responsible for, in a sense of you kind of can choose to be mentally healthy or not? Were they optimistic about us addressing the mental health challenges we face?
It found Australians place a high value on mental health. 80% say it's as important to the nation's well-being as the economy and education. The study then drilled down into how engaged people were about mental health and whether they thought enough was being done.
At the kind of one end of the spectrum, you've got the empowered optimists who think that mental health is incredibly important, but they themselves think the system is working. If you can find help, it's not that hard. You get other groups like the discouraged battlers that think, yes, there is a mental health crisis, and in fact, it's very hard to get help. The best communications campaigns and education campaigns in the world aren't going to make that group think, well, suddenly it's going to be easier for me.
The largest group, 27% of respondents, are called the conditional sympathisers. They recognised mental health as a major issue, but are unlikely to have actually engaged with the system, and it's not a priority for them. Australians for Mental Health Executive Director Chris Gambian says the research will help tailor programs based on people's attitudes.
One size just doesn't fit all, so this is going to be a brilliant tool to help us, to help government, to help service providers, to help all sorts of organisations, companies talk to the Australian people about mental health in a way that works so that we can start to really engage properly.
That's Chris Gambian, the Executive Director of Australians for Mental Health, ending Angus Randall's report.